Okay, so this is the Radiology Department Unit-Based Council project for 2023. It's our BROSELOW Pediatric Airway Cart. It's an organized system to establish an airway in a pediatric patient that is decompensating. And it's also a tool for the pediatric intensivists for their pediatric sedation cases. It has everything. We work with Dr. Kamani, and it has everything they would need to intubate a pediatric patient, as well as everything that we would need in easy recovery of an appropriate item for a pediatric emergency. So it's our Pediatric Airway Cart Project 2023. And so the reason why we did it, the literature supports a systematic BROSELOW type cart to optimize achieving and establishing an airway in a pediatric patient. So there's a literature review that we did, and we worked with Dr. Kamani, and we came up with this hybrid cart for airway. So we don't necessarily, for a pediatric sedation case, need a BROSELOW tape. Each drawer is organized according to a weight range, a pediatric weight range. So if the patient is having a sedation, we already know their weight, but if there's a pediatric emergency in our department, we can use the BROSELOW tape, which we have up here, and it correlates the type of item and the medications correlate with the color-coded drawers. So what we're going to do is, it does not include any medications at all, but we need to make sure that this cart is organized and stocked and it's sustainable, so that we'll always ensure that we have the appropriate item and the appropriate amount of items available anytime. So first, we're going to have this cart stocked. What we have out here, we have a zip tie. It's a plastic zip tie. So what we will do is, after each use of the cart, we're not going to have it restocked because it's not, technically not a resuscitation cart, but we will zip tie it closed here, and then we'll cut as we need the lock open. And each drawer has a sticker. These are removable stickers. So you only have to restock the drawer that you used. So say my patient's at like 24 kilograms. I would only have to open and restock this drawer. And every case that you use this for, you will have to open this bottom drawer. And the bottom drawer is all of the airway supplies, non-rebreather masks, the pediatric mask, adult size mask, every size airway support that you would need. It's got extension tubing, and each one is itemized. So this one, for example, says oxygen extension connections. There's 4. So if you use one, just put one back, right? So each drawer has a card as to how many belong in each little section. So like, say you use one of these, well, obviously that's all you have to restock. And say your Dr. Kamani needs a Miller, size 2 Miller for intubating a patient that she didn't anticipate intubating. And this is the appropriate size for the 24 kilogram patient. So only restock the drawers that you use, and then put another sticker with the date that you restocked it. It just keeps things systematic and organized, so that I would just put another sticker here and another sticker at the bottom. And there we go, close it, and then there's zip ties. There's zip ties on the top, so you would just zip tie this shut too. So no one takes the items out, especially manifolds. There's 3 manifolds in this drawer, and that's always in short supply. So that's how it's organized. That's why we're doing it. And so
Anna's going to give us an example of how easy and fast it is to grab something in the case of an emergency. She's going to be the doctor, and she's going to shout out a few things, including the weight and what she needs, and I'm gonna show you how easy you can grab items and hand them to the doctor and keep the patient safe. So Anna, go ahead and shout out what you want.
Alyssa, my 15-kilogram patient is decompensating. Can you get me an ET tube, uncuffed, a Miller blade, and an oral airway?
Okay, perfect. 15 kilograms right here, so it's gonna be the white tray. She asked for an oral airway right here, an uncuffed ET tube, already sized for this patient, and a Miller. Everything in the cart, and that was what, maybe 3 seconds to grab all of it?
It's a right item, right size.
Right item, right size, yes. And what's nice is when we have to restock it, each section has what size it is, what it is, and how many are in there, so it's easily restockable. That is why we do this, to keep our patients safe.
Awesome.